Hi, Paul Haas here, physiotherapist. Today we're going to go through the knee medial ligament stability taping technique. The aim of this technique is to try and control the inside of the knee, where after you have a sprain of the medial collateral ligament, the knee can become somewhat unstable. So we use a special taping technique to try and control that stability. Now, our tapes of choice for this, we'll start with a fixed tape as an underwrap tape for the for skin protection, and then we'll choose either a 38mm or a 50mm professional strapping tape. There are some other alternatives. We have our premium range strapping tape, and also we have our hypoallergenic with no zinc oxide or latex. So there are various options that you can choose, but today my choice of tape will be the professional tape. It's the most strongest and adhesive. And to finish that off, we'll use a Stretch Band Plus compressive tape to lock everything together and provide extra compression and support.
Okay guys, so we're going to go through a medial collateral ligament taping technique today in the position on the table. So normally our athletes or patients, we like to tape them in a standing position, but we at STRAPIT aren't a big fan of this because when your patient is standing, at least in an athletic population, they tend to be talking to their teammates and to their coach, and what they do is they wobble and move, and when you're trying to get stability through the knee, that just doesn't happen. So down the line, down on the side, they're nice and relaxed in a good position. You've got more control, so you get a better taping technique, which is what we want. So let's get going with this. Now, first of all, we're going to do some skin preparation, and to do that, we're going to use some of our STRAPIT hypoallergenic fix-it tape, which is our underwrap tape. No latex in this tape, guys, so that's fantastic because it just means that we reduce the risk of any skin reactions. And just remember, you always want to warn your patient that there is a small chance that they may react to tape. So you just give them the basic warning just to be careful of any excessive redness or significant itchiness. Okay, so here's one of our areas that we prepare. Okay, so just down towards the upper part of the leg. Okay, and you can wrap that right around. And we have one for the top. So the 10cm fixer tape is quite wide. You have to just watch this, that the tape doesn't back up on itself, which can happen at times. I generally grab the tape like this and we apply like so. Okay, so just creating our barriers, our borders, and then we have tape in the middle as well. Now, remembering that the medial collateral ligament is quite a large, wide, broad ligament. It's not round like an Achilles. It's more, or sort of some of those more round type tendon or ligament structures. It's much broad like a fan. Okay, so which means that we want to set our tape up much like that. So a good generous area we apply our tape on. Okay, now we've got here our STRAPIT Pro professional tape. This is our 50mm version, and what we're going to do here is start with our anchors. So pretty much going over the area of the underwrap. 50mm is good because we want some generous points to anchor with, so you just get a much greater area there, and we come down to our distal aspect, same thing. It's very strong tape. Don't have to apply excessive tension with these anchors. Just apply the tape and don't overdo it. Okay, so we just apply those anchors down. Okay, so now we've got the patient in a really good position. We've got natural gravity pushing the knee in a varus moment, which is perfect because we're trying to stop the knee going in a valgus direction. So the nature of gravity allows that to give us a very good position to do the taping. Okay, so when we tape, I apply generally 2 or 3 of these direct superior to inferior taping bands, and so what we generally like to do, if you rip the tape at the bottom, you can apply that pressure. So just increase that valgus stress, again because we're trying to gap the knee, or stop the gapping I should say of the knee into a valgus position. So you can do 2 or 3 of these techniques. Doesn't matter if you go, your tape is ripped at the bottom or the top, as long as you apply that tension there. Okay, I'm sure Amy can feel that pressure. So guys, you can have 2 or 3 of those working in the barriers of your underwrap, so you've got that sort of area that you can work off. Okay, and from there we start to do more of our diagonals, our herringbone technique. So again, applying, this is where you start to wind the knee up a bit more. Okay. You can also see the knee is in that position of about 20 degrees flexion. Now if you really want to lock the patient off, you can apply more flexion, but they will struggle to move. So the more flexion you apply, the more you don't want to be playing sport because they can't run. So this is just a nominal amount of flexion here. So 2 or 3 of these. Okay, so here the second one I've gone a little bit more with my superior arm, I've gone more posterior, and here to more anterior. And here you can see we're starting more anterior and coming behind. No creases here. Applying that get that valgus stress. Okay, and coming down. Okay, and from there we lock off as we started. So locking off our anchors. You can see we've got great coverage of our medial ligament here. Okay, so here we get that nice support. Okay, so you can see here, because we have areas where the other part of the leg is not taped down, our anchor isn't truly fixed. So what we like to do is use an overwrap to further support the knee and assist with our anchor points and that compression and proprioception. So at this point, we ask the patient to stand up, and just move my tape here, and we'll just get Amy, if she can, to try and stand up on the table. Sometimes you assist your patient up. Okay, and so Amy here is going to stand out. The patient can put their arm on your shoulder if you need to, for that support. And you can see here we've got nice support of the knee, so when the patient flexes the knee, we have our anterior bands tense up, and if the knee straightens, we have our posterior bands tense up. So we're supporting the knee from both directions, and you hope also by the nature of the position that you're trying to avoid that valgus stress of the knee. So at this point we apply our overwrap, and today, just for ease of use, we'll use our stretch band light, which is a hand tearable tape. Okay, and so what we do here, so we start inferior, we come around, apply a couple of these, advance the tape, and what you do here is you guide the tape around, not too much, trying to avoid too much tension, and also watching the kneecap. You want to pass over the top of the kneecap. You advance the tape again. There, come around, not too much tension there. Advance the tape, coming around. And I've advanced it further. Come around again. Just covering all our areas today. Advance the tape, just watching that kneecap again, guys. Coming around. Just making sure also the patient is not in that valgus position, so their knee's not coming in towards you. And so we just apply that down here. Not too much tension. Watching the kneecap again. Coming around to finish off at the front. Rip the tape. Just lay the tape down. And just for extra locking off, we just apply a bit of 50mm rigid tape just to get that nice and secure, locked off. Okay, so there you have it, guys. So we've used a combination of our STRAPIT hypoallergenic fix-it underwrap. We chose today our rigid STRAPIT Pro tape, and as an overwrap we've got our stretch band light, which is a nice compressive support, and then your patient's good to go, well supported, good compression, proprioception, and off we go. Cheers.